Hello. In this visit, I'll talk about using aspirin to prevent cardiovascular disease. But the most important thing that men and women can do to reduce their risk of cardiovascular disease is to stop smoking. So if you smoke, please stop today, right now. This is your day to stop. My recommendations are based on the United States Preventive Services Task Force recommendations of 2009. They're available on the internet, and I've included the link on the end title. The prevention effects of aspirin are different in men and women. Aspirin reduces the risk of heart attack in men, but not in women. And aspirin reduces the risk of stroke in women, but not in men. To decide whether a woman or a man should take aspirin therapy for prevention, we need to know the risk of stroke that a woman faces or the risk of heart attack that a man faces. That's because aspirin therapy causes an increased risk of harm from GI bleeding, bleeding from the stomach or intestines. And aspirin increases the risk of a rare kind of stroke called a hemorrhagic stroke. Men who are less than 45 years old should not take aspirin for prevention of heart attack because the risk of side effects is greater than the benefit of heart attack prevention. And women who are less than 55 years old should not take aspirin for the prevention of stroke because the risk of side effects from taking aspirin is greater than the benefit of stroke prevention. If a man or woman is greater than 80 years old, there's simply not enough data available to make recommendations about aspirin therapy. Men from 45 to 79 should take aspirin when the benefit of heart attack prevention outweighs the risk of GI bleeding. Women from 55 years old to 79 years old should take aspirin when the benefit of stroke prevention outweighs the risk of GI bleeding. Men can learn their 10-year risk of heart attack by going through my heart attack risk assessment series. There are 3 visits that allow a person to determine whether he or she is at high risk of heart attack or heart attack death. Both men and women should do the heart attack risk assessment because both need to know their heart attack risk, but women also need to determine their stroke risk to determine if aspirin for prevention will help them. Women can determine their stroke risk by going to the internet to the Framingham Stroke Risk Calculator. I've included a link on the end title of this visit. There's also a visit called Women's Stroke Risk on my YouTube channel, which goes through the steps of the Framingham Stroke Risk Calculator so that together we can calculate your stroke risk. If a man 45 to 59 years old has a 10-year risk of heart attack or heart attack death of 4% or more, it is likely that the benefit of aspirin therapy will outweigh the risk of GI bleed. If he's aged 60 to 69 and has a 10-year risk of 9% or more, aspirin therapy will likely benefit him. If the man is from 70 to 79 years old and his risk is 12% or more, then it's likely that the aspirin therapy will benefit him. But the risk of aspirin therapy goes up with age. This is because the risk of aspirin therapy, GI bleeding, increases with increasing age. So, for aspirin to be beneficial at a higher age, the person needs to be at a higher risk. For women aged 55 to 59 years old, the 10-year risk of stroke needs to be 3% or more for the benefit of aspirin therapy, stroke prevention, to outweigh the risk of GI bleed. If a woman is aged 60 to 69, the 10-year stroke risk must be 8% or more for the benefit of aspirin therapy to outweigh the risk of GI bleed. And for women aged 70 to 79 years, the risk of stroke over 10 years must be 11% or more. So, as women get older, they need to be at higher risk of stroke before the benefit of aspirin therapy outweighs the risk of GI bleeding, because the risk of GI bleeding increases with age. Now, these numbers I've just mentioned apply to people, both men and women, who are not taking NSAIDs, nonsteroidal anti-inflammatories, medicines like Motrin, Aleve, Advil, and who have no history of ulcer disease and who are not having abdominal pain. If a person, man or woman, has a history of ulcers, is taking NSAIDs, or has abdominal pain, the risk of GI bleeding is much greater. A man or woman with any of these three problems should not even consider aspirin for prevention without a thoughtful discussion with a doctor. The numbers I mentioned earlier for men and women do not apply to you. If the benefit of aspirin therapy does outweigh the risk, then the preventive dose of aspirin is 81 milligrams daily or 325 milligrams every other day. More than that amount of aspirin will not give you extra protection, but it will markedly increase your risk of side effects. Now, if you'd like to get the full recommendations and the evidence on aspirin therapy for both men and women, you can go to the preventive services link listed on the end title. Well, that's it for this visit. I hope you find it useful, and thank you for watching.